Hi everyone. So today we will be discussing about the AETCOM Module 2.8, which is for the MBBS students. What does it mean to be the family member of the sick patient? In the previous videos of AETCOM, we have discussed about the empathy and sympathy towards the patient and their relatives. Now let's understand how it feels to be actually the part of a family where a person is sick, and how do you manage that, right? How the quality of the life of the family members is disturbed because it affects them physically, psychologically. There is an emotional impact, and financial aspect is also there, and the social life is also hampered, and in fact the interpersonal relationship amongst the family are also affected because one person is sick in the family. First of all, there is worry in family members thinking about what will be the future aspect or the perspective of their patient's health, like what is the survival rate, what is the prognosis, well, whether it's mostly about with the chronic patient who is suffering from cancer, and the family members need to know what is the prognosis, what is the life expectancy of that patient. So they are always mostly upset, annoyed, helpless, stressed and lonely because they are helpless, because even after the best of the best treatment, some diseases are not recoverable, not curable. So we are not very sure about the cancer prognosis, or a patient who is having tuberculosis, or a patient who is having AIDS, or a patient who had suffered from road traffic accident or the heart attack. Means you even don't know what is the expectancy of the patient, so it makes the persons helpless. So particularly in this scenario, it is very difficult for the family members to talk to somebody who can understand their problems or understand their feelings, what they are going through. Many of the family members, they also develop that why me attitude, why in our family there is a person who is unwell, or what is so wrong with our family that we are not having the normal conditions. The family member is the person who will be giving most of the help or the personal care to the patient, like helping with the dressing or hygiene needs or food habits, or providing them the mobility. Sometimes they develop a feeling of burden rather than taking care of the patient, and they also feel that they are not able to enjoy their personal lives, or it is not more about it's being selfish of thinking about me time or something, but because it is a lifetime thing. Like these conditions of the patients are so chronic, they take years, like a patient with Alzheimer's or a Parkinson's in the family. So follow the sleep loss means because you're constantly checking whether that patient is alive, he's properly sleeping, he has taken the medication, is there any problem around him. So all this makes the person very sleepless, and their routines also breaks. Most common was not being able to go to a holiday. When there was a survey conducted, so we came to know about that the people also complained, or the family members also complained, that they are, as the patient is unwell, so they are not able to plan any family trips, or they are not able to go anywhere, and they are not very sure if they can make their patient travel, whether the facilities will be there in the abroad, or they'll be able to have the food, what are the hospital appointments there. So all this is making them very tired, and many of the patient attendants are into work, or they are working, and they have to take off from their duties to attend to the medical appointments, or for the routine checkups of their patients, which makes them hugely burdened with the financial impact on the families, that they are not able to perform well at their workplaces as well. Like, what is the importance of understanding the problems of the family members is that the after you understand the problems or the needs of the family members, you will be able to help the patients more, or what they really want is more details about their loved one diagnosis, so that the doctor will be more concerned whether the patient attendant is also present, what is the prognosis. They will also make them participate in decision making, and it will also help develop a rapport with the patient. Psychologically support मिल जाता है when the doctor is able to listen more towards the needs of the patient attendants, and they also want a better infrastructure for the stay. Like, these are the basic requirements, like infrastructure should be better, waiting room should be there, more accommodation, so that they can have a proper arrangement or the proper conditions where they can stay. And why they want the longer visits, because they want to spend more time with their loved ones, as they don't know whether it is the end of the life or something like that condition. So the and most of the patients want to take care of their attendants or the family members, because they think that they'll be able to provide the best care. So many of the things are psychologically dependent, so you need to channelize better with the patient attendants. So how can a doctor improve all these things? He or she can use the words that the patient understand in a better language, like which is understandable to the patient, and not taking the medical terms into considerations. And if the patient or the loved ones are asking any of the questions, you should be humble enough to answer all the questions which the patient is asking. You need to look into their eyes, or you need to give them full attention towards what they are saying, giving the details of the loved ones, what things are going on with their patient, what new tests or what upcoming reports are pending or something like that. And if they are having any doubts, or have a disturbed feeling, so they should be able to express in front of you, and you should be compassionate and empathetic enough to understand those emotions, right? So what should be done in the future so that the patient attendants or the patient relatives are also taken care of? So what we can really do is, we can make a screening tool for the identification of the family caregivers who are more emotional, or who can in future develop the health problems, so that we are able to support the family members. They can also have stress or anxiety because of the patient's condition, so you need to give them counseling sessions or something like that. So there can be a family involvement program design, what will be there to all the patient and the family members who are having the similar conditions, or the disease can be included. Patient who is suffering from cancer is able to see another cancer patient. So what is the benefit of doing all these integrated programs is this, because two people having the same conditions give support to one another regarding the recovery. Likewise, because supposingly if you want to be doctor, right? So if you want to crack NEET or NEET PG, so you'll talk to the people who have already registered for the NEET PG, or who are studying for that. Same is the thing with the people who are suffering from the same conditions medically. We want to relate them, like the patient of Alzheimer's or the family members of the Alzheimer's, so they'll be able to relate more that my patient is also having memory loss. So another person will say ki he forgets this, he forgets that, so I try to manage this way, you try to manage this way. So you get so many ideas from the patients or the educators amongst the family, that you are able to support your patient in a better way. There will be also healthcare professionals, nursing staffs, doctor, nutritionist, disease educator, counselors, or the family members. This program can be delivered in any form, like in person you can have counseling sessions, like in on the phone, or you can provide the written materials, you can do Zoom sessions or the counseling sessions, or separately one program is for the patients, another for the family members. These are all the possible things you can provide. Yeah, how it will help is family, or which family members are concerned about their patients and who are able to attend the programs, and why, if they are not able to attend, why they are missing the sessions, and how many sessions have been dropped out by a family member. In the family members, you'll get more satisfaction, or stress related illnesses will drop down, because they are able to more frequently approach to you, and they'll have the supporting system around them, and they'll improve the interpersonal communication and the relationships amongst the patient, right? In the patient outcome, you will be able to help or see that there is disease control by following the self management behavior, and because they feel more confident, and their anxiety and the depressive symptoms are also reduced, because they are able to see more of the patients who are suffering from the same illnesses, right? Like you can provide a program where you can have a email through connection to your patient, or there can be a link between the patient or the caregiver and the healthcare provider. So you three will be in coordination to each other through any of the mails, through phone, through messages, through fax or something like that, so that the responses can be sent to you even if the family member or the patient is long distance, so that they are able to encourage you or convey the message to the patient for the better approach or the treatment. Like if from the last 2 weeks you are not able to have enough medications, so you can recommend a pharmacy call, so that all the medicines are at your place at the right time. If you are not able to drink water more than 2 liters, then you can have a call over to the family member or to the doctor and remind to take the fluids more often. And if there is an increase in the weight loss, then you can tell your doctor within 48 hours, and he or she will be able to connect through the telephone or through the telecommunication with you. All these basic conditions you need to have interpersonal better connections through of calls, through messages, or through any of the support system, but that will ensure a triad between a patient, a caretaker, and the healthcare provider. As a doctor, you need to tell your patient attendant that they need to develop better techniques to help their patient for the better recovery by showing the concern, या आपको sympathy दिखानी पड़ेगी. Like how like if the patient is not able to take food, you can encourage them to take more food or recommend some diet. You can show concern, like you earlier you were not able to move your legs, today you are able to move your legs, or you are able to walk, you are able to climb the stairs, or any of the basic improvement can be a big encouragement for your patient. So you need to encourage your patient in all the possible ways, offering choices and alternatives, like whether you walk now or in the afternoon or after your meal. What are your plans? Try to openly discuss the problem or the illness without involving any of the conflicts, and try to understand the patient's concerns as well, that why this medication is important, and if that patient is not consuming that medication, there must be some side effects, or he or she must be feeling anxious, nauseous, or having any of the side effects. So you need to answer or ask those side effects so that you can plan the treatment ahead, right? Yeah, this is all for today's video, and we need to channelize from both ends, from the patient's end as well, from the patient's attendant ends as well, and as a doctor we need to develop empathy and sympathy towards our patient. So yeah, thank you so much for watching. Like, share and subscribe to my channel for more such videos.